ಈಗ ಆನ್ ಮಾಡಿದ್ದೆ ಸರ್. ಸ್ಟಾರ್ಟ್ ಮಾಡೋಕ್ಕೆ ಒಂದು ಸರ್ ಬಂದತ್ತೆ. ಸ್ಲೈಡ್ ಹಾಂ ಮಾಪ ಇಟ್ಟು ಈಗ ಆನ್ ಮಾಡಿದ್ದೆ ಸರ್.
May I have your attention, a very problem from and all. Okay, first of all, I congratulate the Rashmi Institute of Ayurveda for organizing such a wonderful model and drawing competition. Kudos to them, kudos to Rashmi sir, the young and enthusiastic chairman whose inspiration has led their team to do such a wonderful program. I also convey my congratulations to Harish sir as well, the principal of RREA, and my dear brother, my junior, Dr. Uday sir, who is working in the department of Sanchayanam-2025, who is the charioteer of who is the leader of this entire organizing committee. Congratulations to him as well, and congratulations on behalf of everyone. I take this opportunity to congratulate especially the participants, whether you win or not, that's not a point. The point is that you participated, and that is something that needs to be cherished. Even me and Uma madam, when we went through the models and drawings, in fact, we struggled a lot. I mean, that much, all of the drawings and all models were so beautiful and, exhibited in such a way that it was very difficult on our part being judged to give prizes, but still, we had left with no option but to become rude in your case to select some of the participants. So anyways, according to me, everyone who has participated, all of them are actually the winners. So with that, let me just start my lecture. And when your Abhishek sir asked me which topic I would deal with, so I just chose this particular topic, nervous system. The reason behind this one is that according to the NCSM, nervous system is put in the last semester, in the third semester, and I think in most of the colleges from where you all have come, your teachers might have just started this topic or might not have started, like in my case, or might have even finished that. Whatever the thing it could be. Can I have next slide, please? The weightage of the nervous system, if you see there, it is 14 marks. That means to say that the nervous system can be asked for a long essay, it can be asked for a short essay, or it can be asked even for MCQ as well. So considering the weightage of the nervous system, I chose this topic. And the other important reason for choosing this topic is this is my favorite topic as well. So I would really enjoy teaching this particular thing. Well, I should not say teaching. Why? Because in our as you can see, there is 14. As you can see there, the number of hours that are allotted by the national NCSM is 18 hours. 14 hours to be dealt in lecture hour and 4 hours to be put for non-lecture hour. So it will be a joke if I say that we will finish the nervous system in 18 hours. It is absolutely impossible task as well. Maybe we may finish it just theoretically from the exam point of view, but never for the practical point of view. It is absolutely not possible to finish. And the third important reason why did I choose this nervous system is, as you all know, if you after becoming the Ayurvedic doctors, right? You go to your you may join PG and you may become a teacher, or you may start practicing at your town, or you may practice in your hospitals and all. Like there are quite opportunities after once you finish the BMS. So I'm very sure if you have gone through any of the Ayurvedic hospital, can I know which cases often you will get to see in the Ayurvedic hospitals, guys? Just a casual question. Which kind of cases that you would see in an Ayurvedic hospital? Yes, the diseases which are related to the neurological points, right? We Ayurvedic people are sitting in the driver's seat. We are the pioneers in the world to treat Ayurvedic chronic diseases, especially related to the nervous system. So this makes me the third point to be a valid reason to deal with nervous system. So anyways, like I said, when 18 hours is not possible to finish nervous system, how can I finish in just 40, 30 minutes or 40 minutes? This is again a joke. So what I'm going to do is that I'm just going to introduce you the nervous system so that I will be telling you what important things are there, what mnemonics can be used, and how we need to prepare for the examination, what kind of questions can be expected in the nervous system. So these things let me finish in just 30 to 40 minutes without eating much of you have already, had a very sumptuous lunch already, and I don't want to be a lullaby singer here, so that you can sleep happily and AC room and all under the fans, and so such a wonderful infrastructure you guys have got. I think you are really lucky to be admitted in the reactors. So this is the syllabus. As you can see that there are 7 points if you see. Yes, nervous system. First is introduction and classification, and then he is talking about meninges, and then brain and spinal cord description, and then there is peripheral nervous system, which includes cranial nerves and spinal nerves as well. And then there is autonomic nervous system, very interesting. Then there is formation and the circulation of the CSF. We will go with that point as well. Last but not least, let us end with the blood supply. So every point, when we go with every point, whether it is brain and spinal cord, whether it is peripheral nerve and cranial nerve, whether it is blood supply, whether it is meninges, whether it is whatever it could be, guys, in the nervous system, one point please remember, as always, as you know, according to the new guidelines in the National Commission of Indian System of Medicine from 2022 onwards, for every structure that you read, please go with the clinical aspect. Because NCSM strictly tells these guidelines to teachers and the students as well that every class of yours should end with clinical aspects, and you should expose very early. In earlier days, when we used to be in BMS and all, there was no that strict guideline like we need to learn clinical aspects in the very first phase. It was not like that. When we used to go in the final phase, we used to get clinical aspects, clinical subjects and all, and then we used to learn the clinical. We used to get exposed to the hospital and all. But you guys, you are lucky enough because according to the NCSM, even in the first phase only, your clinical exposure will start very early. So please remember, while you write exam, and if you get any question, I'm not just talking about the nervous system, whether it is coming from respiratory system, cardiovascular system, whatsoever the question it may be, whether it is coming from Ayurvedic aspects like Srodhas, Kala, Siradhani, Ashaya, Posta Sharira, or whether it is coming from the modern aspect like nervous system, direct question and all. So please mention clinical aspects, right? So that is very, very important. So let us go through one by one. As you can see, you just now saw the, according to maybe, that could be, I don't know what exactly the thinking of the thoughts of NCSM. They have given for each point. There are 7 points, and forget about the non-lecture hour. 14 hours are there. That means for each point they have given 2 hours. So there are totally 7 points. So 7 into 2 is 14, and that's exactly what NCSM has given us. So please read or please finish the lectures or reading within 14 to 20 hours as far as possible. Okay. Next. So let's go with the introduction. As if, so first of all, whenever I teach the nervous system to any of my students, whether it is PG or UG, the first thing that I say is what is actually the nervous system is meant for. Why this system is there in our body. So there is the nervous system always revolves around one important aspect, guys. That important aspect is stimulus and response. So what is the stimulus and response? Stimulus is a provocation, and response is an appropriate response that we give to the atmosphere. For example, I am teaching to you what this is the stimulus. I mean, like you are able to listen to me. My words are approaching your ear, and then they are going to the temporal lobe through auditory pathway or whatever. And then finally, what is the proper response from you guys? You listen to me, and you are able to understand. You are able to analyze. If I say that the brain is there in the abdomen, will you accept it? Absolutely, you don't accept it because you know that you can understand, you can analyze whether what is right, what is wrong, and you will finally, get the point. So this getting the point is the response that one can properly respond to the teacher. So like that, in the morning, one of the models I was checking out there. So one was reflex arc. I don't know which team had done that one. So they have shown a limb there. The limb is touching a flame, and as the can described in this total doctrine or philosophy, what you can call it as stimulus and the response, proper response. So stimulus, right to the stimulus, it is the day we need to understand that our nervous system is not working. We need to understand that our nervous system is not working. So remember, when it comes to the nervous system, maybe today you may not understand this point, but tomorrow, right, when you start doing PGs or something like that, you will realize what exactly the stimulus and the response is. Can I have this, please? Yes, the next important point is classification. Like I said, within 40 minutes I am supposed to finish. I am here just to introduce you the syllabus of the nervous system. The very first important point related to the nervous system is classification. Right? So please remember that one, like every surrogate classification. Right? So please remember that one, like every surrogate, if I find in any particular slide, if I find that this question could come to the examination, I will be just highlighting that one. So one such thing, I am really focused with this classification maybe, classification can come in the examination. Guys, remember that one. So when it comes to the classification, we have two types of classification. What is it? The first one is structural classification and the second one is functional. So don't rush to write the functional classification. First write even your trigeminal nerve, which is the largest nerve, largest cranial nerve, they may ask you for 5 marks. So please prepare each cranial nerve in such a way that you should at least be able to write 2 to 3 pages along with a beautiful diagram, and that makes your 5 marks up to the mark with respect to cranial nerves. As far as spinal nerves, I really don't think they will be asked, but anyway, it's very important practically because you see there are 8 pairs of spinal nerves are there, and these 31 pairs of spinal nerves will supply. There are no names by the way for spinal nerves. However, since they emerge from the spinal cord, they are called spinal nerves, and they will supply your thorax, abdomen, pelvic cavity, lower limbs, and upper limbs as well. And as the name itself it says, the cranial nerves are coming from the brain, and they supply your especially the head and neck. There is one exception here. There is one cranial nerve that is longest, and it is not just limited itself. Its functions are not just limited to the head and neck. The functions of it are also extended up to the thorax and abdomen. Can I get to know which cranial nerve it is? Absolutely right. It is vagus nerve. Right. So when it comes to the classification, let me reiterate again. There is 2 types. One is structural, another one is functional. When it is structural, you need to write down central nervous system and peripheral nervous system. And when it is functional, there are actually, when it comes to the classification, we can write for pages together, guys. But we don't have that much time here, and we will not be having that much time there also in the examination. Let us go to the second classification, which is mainly functional. One is sensory, another one is motor. Like I said, sensory is always something that provokes a stimulus in people. You all are listening to me, right? Is it sensory or is it motor activity? It's just sensory activity. And when I dictate something, and if I ask you to please jot down those things which I am telling to you, that's a motor activity or that's a sensory activity? That's a motor activity. So basically, sensory activity are the impulses travel from peripheral nervous system to central. We already discussed that there are 2 types structurally. There are 2 types of structurally. There is how we can classify the nervous system. One central, another one is peripheral. If the impulses are moving from PNS to CNS, we call it as sensory impulse or sensory activity. And if the impulses are moving from CNS to PNS, then that is called as motor activity. By the way, if you get any doubts at any given slide, you can interrupt me at that particular slide, or you can, once I finish my lecture, you can then also ask. I don't have any objection, guys. But feel free to interact, right? Because I am telling you once again, I am not here to teach in the just given 40 minutes. I am just here to introduce the nervous system, and I am here to tell you what is important in the nervous system. Yes. Let me repeat it again. As far as concerned with the functional classification, one is sensory, another one is motor. And remember, there are 2 types, according to sensory and the motor activities, there are 2 types of tracts in our body. How many types of tracts? 2. One is ascending, that carries the impulses from PNS to CNS. For example, spinothalamic tract, spinal cord to thalamus and right? And there is another tract that is descending. That means it is analyzed and what to be done. It will give the brain is a commander. It gives a verdict. It gives an order, and that order will be followed by my verdict. For example, I am standing here. I want to move there. I will move. So I don't automatically. It didn't come from there to here. My brain told me to do that one. So this comes by means of descending tract, and descending tract refers to, yes please, it's a motor activity. And one best example for the descending tract is cortico-spinal tract. As the name itself it says, it is coming from cortex and it is ending in spinal cord. And from there, from the spinal cord, you all know very well, spinal nerves will leave the spinal cord by taking the command received from the brain, and they will go to the peripheral structures like muscles and all, where the activity is actually done. Right? If there is any doubt related to the ascending and descending tract, feel free to ask me later or otherwise. Shall we go with the next one? Yes. As according to the syllabus, let me directly go to the meninges. Meninges. What are meninges? Just like any other organ in our body. Your heart is covered by the pericardium. Your lungs are covered by the pleura. Your abdomen organs are covered by the peritoneum. Isn't it? Right? Your muscles are covered by the deep fascia. Tell me one part, one structure in our body which is not surrounded by any connective tissue. There is no literally. One bone is connected by the periosteum. Your entire body, of course, is connected by the skin medium, which is again connective tissue. Likewise, since brain is a very important, delicate first one from outer side to inner side, the dura mater, the retina mater, and pia mater. So please remember, at least you should be able to write 5 lines regarding each matter. At least 5 lines with a good diagram. Dura, what is dura? Which is what is matter? Matter means mother. Mother is the one who protects us. In the same way, meninges are the one which protects us. So, dura means durable, matter means mother. In the same way, arachnoid. Arachnoid means something that is like web-like. जैसे web spider की web क्या होता है, वैसा ही आपका arachnoid matter होता है. That's why it is being named as arachnoid matter. That is placed right next to the dura matter, deep to the dura matter. And then comes pia mater. Pia mater is something that is so closely invested to the central nervous system. Remember, these meninges, what I was referring to, these meninges are only present in the central nervous system. Please remember, peripheral nervous system is not covered by the meninges. However, peripheral nervous system is covered by epineurium, myoneurium, and perineurium and endoneurium. So that's a different connective tissue, and this is a different connective tissue. So as far as concerned with the coverings of the PNS, they have not put it in the syllabus, and I don't really think that is important. But what is important with respect to coverings is meninges, which are central meninges, which are dura mater, arachnoid mater, and pia mater. And one clinical aspect is there here, guys. What is that? Is in between dura mater and pia mater. So what is present here? A very important nutritive substance is present within this space, and that nutritive substance is called cerebrospinal fluid. जिसके बारे में हम बाद में बात करेंगे. We'll talk about this one later. Anyways, please remember, where is CSF present? CSF present in subarachnoid space. And then comes, there is no sub, that is deeply connected with the the central nervous system. So there is no technically subpyramidal space.